Hi, welcome to this unique hair care initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, hair problem was associated with middle age when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people having hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided and can be fixed by managing to modify our faulty lifestyle. Today, we have with us Dr. Madhulika Gavvala, is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS, MD, DVL in dermatology, venereology, and leprosy. She's currently practicing at Dermvisa Skin, Hair, and Laser Clinic, Hyderabad. Dr. Madhulika has dedicated her career to diagnosing and treating a wide range of hair and skin conditions while providing personalized healthcare services to her patient. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Madhulika is aware of the need for the patient awareness and education about hair care and spends a lot of time in giving talks at various platforms across the country. Thank you, Dr. Madhulika, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Thank you, Mona, for your warm welcome. It's great joining you all here to talk about hair-related problem, which is one of the most concerning issues, the burning topic right now. So this is a great initiative by IPCA. So I'm really pleased to be a part of it and hope to give a little, more insight into hair fall and, associated conditions.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So doctor, today we are going to discuss the role of vitamins and minerals in hair management. So whenever we talk about hair care and hair management, the most common problem which is faced by all of us is the hair loss, irrespective of gender or age. So can you please enlighten us what's normal about hair loss and when to be concerned for?
See, hair loss is so many types. Okay, there are books on it, so that it's not just one thing. Okay, hair loss comes in different shapes, different forms, and for everyone, it's something different. A dermatologist is the right person to diagnose what kind of condition you have. Okay, so regardless of that, just to make the decision to go to a dermatologist or not, that's where like patients are in a dilemma, right? So if you're losing more than 60 to 70 strands or maybe 100 strands a day, that is significant. Anything less than that might be normal. Okay, so it's 61, 62 here and there, you say I got 59, so that is normal. No. Okay, what else usually was your normal and which is not recovering probably in your few weeks or like a month or so, it's still going on and you're still seeing like a little bit of thinning of your hair, a little bald patches, so it might not be normal. Okay, something less than 60 is okay, considered okay scientifically, that is not really significant, and anything more than 60 is considered significant. Sometimes even less than 100 also is not considered too significant in certain patients. Okay, so it's not just losing, because your hair also keeps regrowing. Okay, so as you lose, new hair also comes up, right? So that is why there is a balance that is to be maintained, and when this balance is tipped in favor of one thing, so that's when it becomes significant. Yeah.
Okay, so doctor, why do this hair loss happen? Like, what are the general causes?
Okay, so hair loss are different types, like I was saying. Okay, so I think what you mean to ask is the most common kind of hair loss, which we call as telogen effluvium. Okay, so and the other commonest is pattern hair loss, which we see specific to genders, where it is like males usually go bald right here and females sort of lose hair in the middle. So that is kind of pattern hair loss, where you're losing hair in a certain kind of pattern. And then there is something where is diffuse hair loss you're seeing, that is another kind of hair loss. Usually, to be like very generalized, those are the two main forms of hair loss. So the pattern form, it is usually because of your genetic factors. It's a little hereditary, and there are hormonal issues at play. Okay. So other than that, like when you're losing hair diffusely, there can be your diet. It can be related to your stress, okay, lack of physical activity, of course, other hormonal issues. Okay, not just the sex hormones, but other hormonal issues. These all might contribute to your hair loss problem. Okay. Yeah.
Okay, doctor. So, doctor, now that we know so many causes are there, but nowadays we all have a very bad lifestyle, working late hours and not
Mhm.
eating properly. So, can you please enlighten us that can a person lifestyle also play a role in hair loss?
Lifestyle plays a very, very important role in hair loss, and I always counsel my patients regarding the same, that when you do have hair fall, it's not just like taking medications and being on point with the medication. Something internally and in your environment also has to change. Okay, so because the causes are usually multifactorial, very rarely it's just one thing that's causing everything. Okay, stress, major aggravating factor, and nowadays every one of us is exposed to such chronic stress. So that is one of the, even it increases the cortisol level, and you're losing more and more hair. Okay, stress is one. Diet, we have such bad diet nowadays, so much of unhealthy food. You eat a lot, you put on a lot of weight, but there's nothing healthy that's going in. There's not a lot of color in the kind of useful color in the foods that we are eating. Okay, so I say color because colorful foods kind of are very good for your health, right? So like vegetables and leafy vegetables, you don't take it on a regular basis, so you do not have a balanced diet, and it's sort of a little difficult with that. So stress is one, diet is one. Other than the pollution, when you go out, there's so much of dust. Okay, too much of heat, too much of this thing. So even your hair is also affected by that, just like your skin is. Okay, it becomes dry, it becomes dull, brittle, easy breakage. So these are also the environmental factors that sort of affect your hair issues. So, and also lack of physical activity. Lack of physical activity sort of leads to certain hormonal imbalances in your body. Okay, it's not just one thing. So many different hormones can be affected because of the lack of physical activity, and you can not just have like severe issues like diabetes or hypertension, but these are also a part and parcel. Even hair loss and patchy hair loss, this all sort of happens because of hormonal imbalances. So these are like a few causes. Yes.
So, lifestyle do play a lot, really important
Yes.
for our hair loss.
Yes. Yes.
Healthy lifestyle. So, Dr. Now that we know so many causes and hair loss, so can you please enlighten us, like what are like some medical treatment options available for hair loss? Like, is there some surgical or non-surgical, or like topical, or there is some oral also? We can just eat and manage our hair loss?
Okay, so yes, different forms of treatment are available, like you were stating, and it depends on what kind of hair loss you have. Okay, it's not one shoe fits all. It has to be, tailor made for each of the kind of pattern hair loss or phelogenic, whatever you have, because based on that, we usually select your treatment. But generally, to put it into categories, you have topical medications which you can apply. Okay, almost like an oil you can apply on your scalp. Those are topical medications. Oral medications which you can take in, which can be something as simple as a nutraceutical, like a vitamin or a mineral supplementation, to something like a more advanced form of medication like anti-androgens or some other things which might be needed. Okay, so other than this, these are like medical treatments. Then you go for procedural treatment. Sometimes plain medical treatments might not be working. In such cases, a doctor might suggest you that use we just go for a procedure, say PRP or GFC. Okay, you might have heard like platelet rich plasma therapy or growth factor concentrated therapy, where we take growth factors from your blood and inject it back into the scalp so as to promote the hair growth. Okay, as simple as that. So procedural wise, you have that, and you have mesotherapy and so many other things. And then of course surgical correction, which is like a last ditch option if nothing else is working for you. So there's possibility of hair transplantation, where we can use densely populated hairy areas, the hair from there onto the other areas of the scalp where it's more scantily distributed. So even hair transplantation is like a last option, or if you've already advanced the stages in your hair fall, that might be the only option that's left for you. So these are the basically the main treatment options for hair loss. Yes.
So, like, even if you have no solution, we always can have a surgical procedure also to get our hair.
Yes. Yes.
So, doctor, there is a word called nutraceutical, which is, nowadays getting a lot of So what is it? Like,
Yes.
what is the role of nutraceutical in hair loss?
Okay, nutraceutical is nothing. It's just intake of nutrients, okay, in the form of a drug, right? So, sometimes, like I was saying, you do not have balanced diets in our regular this thing, and maybe it's also not very realistic to expect that you are going to eat every other, vegetable which gives you whatever nutrient you need. So, it is sometimes not realistic, and in such people, maybe a nutraceutical is an option to give them the recommended daily allowance of a particular nutrients. Okay, so usually nutrients are like macronutrients, micronutrients, okay, trace elements. We need all these for the proper functioning of not just the hair, general bodily functions. To everything to go in order, you need all these in a certain amount, and that's been decided according to your gender, according to your weight. Already it has been decided. So nutraceutical is nothing but it is supplying you your recommended daily allowance as per what is your need. Okay, so specifically correction of one thing might be needed, like say you have a vitamin D deficiency, you have iron deficiency, B12 deficiency, that don't get corrected with the RDA kind of nutraceutical preparation. That needs like separate proper medical dosage kind of treatments that you will be needing, right? So based on that, so nutraceutical is a good option for someone who is not taking intake properly and sort of needs a supportive treatment along with all the serums and everything they are using. It might be a good supportive treatment. Standalone, it's not going to be helpful, obviously. Okay, but along with in conjunction with other medical treatments, definitely it is, there is enough evidence to suggest that it is of some help. Okay, so although it is controversial, some people say no, they don't work at all, some people say they work very well. Okay, so it's somewhere in the between. It's not that it's completely useless, it's not that it is a miracle cure. So it is helpful as much as like in conjunction with other treatments, but not standalone. Yeah.
Okay, so the combination is the key to manage our hair.
Yes. Yes.
So, doctor, like you said, so many like nutraceutical is vitamins, minerals, and for our
Right.
hair. So, can you please, tell us that which are some of the vitamins used in the management of hair loss, like alopecia?
Right. So alopecia, again, there are so many types of alopecia. So I'm, considering that this is your androgenic alopecia or something. So usually in androgenic alopecia, it's a genetic and hormonal thing, like I was saying. Here, nutraceuticals are not like, other than the RDA, or if you have some deficiency, they are not the first line. Usually for telogen and effluvium, okay, where you're losing a lot of hair diffusely, that is where there is usually some internal deficiency that is leading to this hair fall, right? So in those cases, these nutraceuticals will be helpful. And what nutraceuticals are you usually using? So iron is one. Okay, it's a very important thing. Anemia, it's very common in female, so that needs to be corrected. Vitamin D, that also, because we are not at all exposed to sunlight these days, and you're always wearing sunscreen to protect your skin, so you're forgetting that your skin synthesizes vitamin D when it's exposed to the sun. So majority of us are vitamin D deficient, right? So vitamin D is a very, very important. Majority of the hair loss problems, vitamin D, I see that there is a deficiency always associated. Okay. So other than vitamin D, maybe micronutrients, like zinc, copper, selenium. There's a little biotin and other B complex. So there's a little kind of, studies are not that great regarding everything. There's only like few studies here and there. But of course, it's not that they're completely useless. Definitely, RDA of certain essential elements, like vitamins, essential vitamins and minerals is required for your daily proper functioning, not just of your hair, but of your general body also. Okay. So don't go about just taking, these preparations by yourself. Always go with a dermatologist's prescription, that what you need, whether you need it or not, whether the quantity in the thing that you're taking is sufficient. Because some people also have a tend to overdose also, because they think it's so good, they take more pills of it. Maybe that is not the dosage that is advised. Okay, so there are a lot of pitfalls to this. So have a dermatologist at your disposal, have them guide you through your journey of hair loss, so you have someone to hold your hand. So that is about it. So these are the elements that will be usually be supplemented when your dermatologist is correcting your hair loss. Yes.
Okay, so very informative, doctor. So,
Sure.
doctor, like these you have told like minerals like iron. So, do minerals like zinc, copper, like so many minerals are there? Do they promote hair growth?
See, standalone, no, okay, because there are complex mechanisms basically behind, the hair growth, what is happening, why the hair is falling. So much, still much of it is not understood, okay. But there are few studies that have shown that these are helpful. There are few studies which have shown the separate, like, correction of this is usually not needed unless there's like a deficiency. So, like I told you, it's neither here nor there. It's in the middle ground. Go with your dermatologist. If he says like use it, otherwise don't, okay. So, but they have some evidence. It's not like it's completely there is no evidence. There are studies which suggest that iron, so definitely iron, if it is deficient, you are losing your hair. But micronutrients, especially trace elements and micronutrients like zinc and selenium and copper, these are a little here and there, okay. But if you are deficient, probably it needs to be corrected then. Yeah.
So, doctor, like you said, RDA. So, what is RDA? Like, is it required to take these nutrients as per gender RDA requirement?
Yeah, so like I was saying, recommended daily allowance of a nutrient, okay, even if it's a macronutrient or a micronutrient. Macro is basically fats, carbohydrates, proteins, right? And micro was all the things we have, vitamins and other things we were talking about. So, do you need to take? Yes, you need to take it, but do you need to have a pill for it for every time? Not necessarily, okay? So, if you are taking a very balanced, healthy diet, maybe you do not need a supplementation, okay? And you cannot continue taking a supplementation forever, right? So the basically the trick is use the supplementation while you are transitioning to a more healthy diet. That is a better way to put it. And yes, of course, you have to take it according to your gender and weight, otherwise you will be undernourished, malnourished, right? So these things are needed, and you will suffer the consequences of the deficiencies of not taking it, okay? Say vitamin D or iron, your deficiency, not just like the cosmetic aspect of it, your general well-being also is affected in these deficiencies, and so many host of other symptoms will pop up because of it. So you should take based on the RDA, and each nutrient has a RDA that has been fixed by the say an ICMR or the Indian, basically the body has for the Indian male and female, and according to their weights, it has already been fixed. For children it's different, for adults it's different. So you can go through all that information and then decide whether you are on the right track to having a more balanced, healthy life. Yeah.
So instead of just going through internet and just taking the pills, all the right.
Yes. That's not really right. Yeah.
So, doctor, stress is something which is unavoidable by any of us. So, is there
Right.
any impact of stress on our health?
Yeah, like I was saying, in the causes of hair loss, stress is one of the major aggravators. No matter what kind of hair fall it is, whether it's alopecia areata or telogen effluvium, pattern hair loss, doesn't matter. Stress is one of the major aggravators. Chronic stress, especially, work-wise nowadays we face so much pressure on a day-to-day basis. Our work hours are so bad, right? We lack sleep. Definitely, this has a bearing because your hormonal milieu is sort of disturbed because of this. They're all thrown haywire, because of which it sort of it shows effect on your general well-being as well as, of course, your hair also, okay. So there's more hair loss in people who are chronically subjected to stress.
Okay. So, doctor, like when we are stressed, this is something like every mother tell us that apply the oil, do the chumpy, do the massage. The more oil you put in your hair, the more long will be your hair. The more hair growth will be there, more good the hair will be. So, is it like oiling hair is a ban or a boon?
I wouldn't say bane or a boon, neither of them. So it is, if you use the proper product, okay, for the proper amount of time and the way it should be used, is definitely a boon, okay. And but if you overdo it, of course, it's a bane, okay. So it can be both. It depends on how you're using it and what you're using. Usually, like patients ask, "Can I oil my hair? Will that help?" So usually consider oil like a moisturizer for your hair. Basically, that is what oil is. Very rarely, like some kind of oils have been shown to have some hair growth properties, but do not believe the miracle oils that they're trying to sell you on social media, okay. So that is not possible. Even nowadays, a lot of rep has come for rosemary oil and castor oil. They are like, these are really as good as medical grade preparations. Okay? There are hardly any studies on this, so I'm not completely dismissing that they are not useful, but there is also limited evidence. Okay, so we can't generalize it. So of course you can. What is the proper way to oil? If you ask me, 1 hour maybe before your head bath, you can just apply oil. So it's sort of, if you have dry unruly hair, it sort of smoothens it out, and when you use a shampoo on it, it won't dry out, because you already use a shampoo on a dry hair. It is going to dry it out further. Okay, no matter how much conditioners you use. So it's a natural conditioner. Oil is a easily available conditioner, so you can use that. Preferably do not leave it for long, because that tends to cause like flakiness of the scalp, where it causes dandruff and other issues. Those are aggravated. Okay, so it depends. If you do not have like an oily scalp, oiling is of course okay for you, but don't overdo it. Okay.
Okay, so it can be used as a conditioning of our hair.
Yeah, conditioning. Yes. Yeah.
More of a like hair growth kind of.
Yeah. Yeah.
So, Doctor, can you please give us some important tips for healthy hair?
Okay, so healthy hair, first I would suggest that go consult a dermatologist if you have hair loss. But of course, what you already have, you should also know how to preserve it and not damage it further. So hair styling is one thing. I know we all do it because we have so many of social events to attend and all. So we're frequently blow drying, straightening, curling and everything, especially, with females. And with men, they are using so much product in their hair and so many chemicals and everything. So I would say go less with styling, however much it is possible to avoid. Less heat. Okay, and especially the curling tongs and going directly with the straightener is more damaging than say a simple blow dry. Okay, so and then minimize the amount of times in a month you're going to style your hair, and then use the proper products. That is important. Heat protectant sprays, or then serums and even conditioners and all. Be very generous with the amount that you're going to use. Do not use too much product. Do not use hairsprays, and don't leave it in without washing. Okay, so because repeated styling sort of dries your hair out, and then of course it's going to break much more easily. Okay, so styling is one. And then of course many people ask me about shampooing and conditioning. Okay, so shampoos, conditioners, I wouldn't say they are useless, but they are of course only moisturizers for your hair. Okay, so shampoo is a soap basically for your hair, and conditioner is a moisturizer for your hair, and that is the purpose they are going to serve, unless it's a medicated shampoo, right, which is going to sort of have, you are going to leave it on for a while and it is going to show effect. Other than that, shampoo and conditioner are only for maintaining the shine of the hair, the luster. To maintain that is good. So other than that, do not expose it to too much pollution, too much sun. Okay, if you have to go out, using like a leave-in conditioner to sort of protect your hair. Also use hair masks if you have to go somewhere too much dusty. Okay, and then at least weekly twice take a head wash. Okay, and then don't overdo it. Don't take it daily. Okay, because shampoos and too much of washing tends to damage the hair. And then if you want to like comb your hair out, do not like use like very kind of combs which are very fine tooth, right? Use a white tooth comb so it doesn't tangle a lot and doesn't break a lot because of that. So these are some of the things that come to mind when you come to general hair care. And of course, eating healthy, reducing your stress, having some physical activity, that always helps. Yeah.
Thank you so much, Doctor, for such a enlightening tips for us. This discussion was very informative. I'm sure our viewers would be benefited by it. So, Doctor, can you take some live questions from our audience, please?
Sure.
Okay, the first question is it true that coloring your hair will damage it?
I would say yes, to an extent, especially when you're using something which too much of PPD or ammonia, which are like more chemicals which are kind of damaging to your hair as well as your skin also. So those of course do affect. So here it matters what kind of hair dye you're using. So if you're using the proper hair dye, and go to a salon or use it the proper way that you're supposed to. Okay, do not overdo it, and don't use something that's going to give you a lot of too much of black color. Of course, there's a lot of chemicals in it. Okay, it stays on too long, almost for too long, too many chemicals. Okay, so go no PPD, no ammonia as much as possible, and keep the hair dye only if like you have significant amount of gray hair which is affecting the quality of your life. Then only I would suggest a hair dye. Otherwise, routine coloring, then unless it damages. Eventually you keep doing it, it is going to damage your hair. Yes.
Okay, another question is very interesting. Hi, doctor. How are you? Is it true that cutting your hair frequently can make the hair growth faster? Is it true? Because someone told me that if I cut my hair will grow fast.
I don't think so. I think that's a myth. I think when your hair is already short, you notice even if an inch comes up, it's more, it grows from here. It doesn't grow from here. So I don't understand the concept of, cutting when you have split ends. Okay. It makes your hair look healthier, right? Because you're cutting off whatever is a little already dull, dry, and damaged. So it makes it look healthier, but it doesn't make it grow faster because that has to come from the inside and hair grows out from here, not from here. Okay, so it's growing out like this. So how, I don't understand how that can sort of, so I think that's a myth that you've been told. Yeah.
Yeah, very true, doctor.
Right.
So another question from a viewer is, Doctor, my scalp is dry and I always get easily dandruff and I keep itching it. So do my hair have bacterial growth? Why do I have my dandruff so much?
Okay, so dandruff, sometimes he has dry scalp as well as dandruff. Usually dandruff is with oily scalp, okay? And maybe we have to look at, okay, what his condition is. It might be dandruff, it might be something that is mimicking dandruff if it is that dry, okay? So I would suggest him to go see a dermatologist, but if it is really, in fact, dandruff, it is not a bacterial infection, it's a fungal infection. And I think if you visit any dermatologist, they will easily give you a few medication recommendations, and that can sort of maintain your dandruff, keep it at bay for as long as you need it. Okay, right.
Another question from our viewer is very interesting, and I think every female wants to know. Doctor, can I do hair spa every day and make my hair grow faster and healthy?
Okay, hair spa is basically putting conditioner on your oils and conditioner on your hair. So it's going to make it look soft. It's going to make it look very, full of luster and shine, but it's not going to make your hair grow unless they are putting something on your scalp. Okay, any product that is actually shown to be scientifically proven to be a hair growth, molecule. So I don't see how a hair spa can sort of increase your hair growth, but definitely your hair will look healthier after your hair spa. You can do it at your home also. You can just condition, but don't do it daily. Once a week or once in a couple of weeks should be okay. Just a little bit of conditioner and oil. You put it, you leave it on for some time, and then you wash it. It feels softer. It feels nicer. Okay, so it's a feel good thing and a good thing to make your hair look shinier, but not, I don't think so, for hair growth. Yeah.
Another question from a viewer is, hi doctor, I have androgenic alopecia and I'm taking vitamins and minerals, and someone told me that I have to take these vitamins and minerals for whole life. Is it true? And I'm also from Hyderabad. Can I visit you?
Okay. So yeah, you can visit me. I think my clinic is in Manikonda. That is already displayed there. So the thing is, nutraceuticals, like I was saying, it is not forever. Okay. Like I was told you, it has to be to help you to transition to a healthier, diet and lifestyle where you can maintain it with more natural things. Unless you have like a chronic deficiency where you're not at all eating food, I don't think it's forever. Okay, so it can be usually max like a couple of months. I don't think anything beyond that is advisable, because even you can end up with toxicities if you use too much of supplementation also. So instead of having the beneficial effects, now you're landing up with all hypervitaminosis and other kind of issues. So be very cautious of what you put into your system, and do not do it without a dermatologist prescription. Yeah.
So another interesting question is, everyone wants to know nowadays, we have so many. He's asking, hi doctor, someone told me that lemon juice, onion juice can make my hair grow. I don't have hair in the front part of my head. So can these home remedies help me to grow my hair again?
Okay, so home remedies, like I told you, I'm a little skeptical about them being really, worked. Lemon, I understand that it's citric acid, so I've seen people use it to bleach their skin, like almost like an acid, then ending up with rashes and all. But I've never heard about hair growth. Okay, so I don't think so. If anything, I think it acts like a bleaching agent because it's an acid. So lemon, I'm not aware. Onion nowadays, I think it's been promoted so much, that onion oil, onion shampoo, and everything. So I don't see a lot of scientific evidence with it. So if it works for you. It's not that, do not overdo it. I can't possibly advise you to do it, but if it's something that's helping you, then I can't argue with it. Okay, but there's no scientific evidence to suggest that lemon juice or onion juice, because there are no studies done in this aspect. So I don't think we can comment on that. Yeah, but I would suggest avoid lemon juice and all. Don't use it on your scalp. Onion, I am not aware, but lemon, though, I wouldn't suggest at all. Yeah.
Like you said, self prescription should be avoided. It's better to visit
Yes.
a dermatologist.
A doctor. Yes.
Another question is, doctor, I was pregnant and then I had a baby and I have started falling hair, and then it gets stopped automatically. But now again, I am having hair loss. So is it because of my pregnancy, or it is because of my type 2 diabetes, which I have been diagnosed recently? Yeah.
Okay, so she's diabetic and then she recently went through pregnancy. So in post-pregnancy hair fall is common. That usually recovers. Okay, it's not something to be very seriously concerned about unless it is like too much significant. Okay, usually it recovers post-pregnancy loss. But diabetes, if she's already diabetic, we'll have to see if she has any other associated, illnesses that might be leading to hair fall. Diabetes directly doesn't, but maybe a little bit of hormonal changes or something that's happening because of her unhealthy lifestyle or something that might be contributing to the problem. So she needs to be evaluated properly, taking all her problems into consideration. It's not something we can just do it offhandedly. So I would suggest her to visit a dermatologist directly, because that needs to be looked at. Okay, post pregnancy hair loss, that was okay, but after diabetes and you're still losing it now after so many days, I think that needs to be looked into a little more closely. Yeah.
Okay. During after post pregnancy, every woman face hair.
Usually they do, yeah.
Another interesting question is, doctor, you said overweight problem can lead to hair loss, but I'm doing a crash diet and still I'm facing a hair loss. So I'm doing dieting to lose weight. Why I'm not having healthy hair?
Right. See, overweight, when you're overweight, like I told you, the hormonal issues sort of, that are happening inside are causing the hair fall, right? So now you've been advised to lose weight. But crash diet is not the way to go. Okay. Crash diet, what you're doing, you are deriving your body of essential nutrition. Okay. So in this case, what happens? Your body doesn't know where to send the nutrition. It only sends it to the vital organs. Hair, it doesn't consider as vital as you consider it as. Okay. So what it does, it reroutes the whatever nutrition is available to us, essential bodily functions. So hair sort of gets neglected and you start to lose hair. Okay, so that's another kind of hair loss that happens in crash diets. So if you want, work with a nutritionist who can give you a balanced diet, and then also with someone like a physical trainer or someone who can help you burn the calories that you are taking that is required. Okay, so it has to go hand in hand. Only dieting is never going to help you. It has to be diet, physical exercise, both should go hand in hand. Yeah, otherwise you'll keep losing, because of your dieting you'll keep losing your hair. Yeah.
So diet with a lot of like healthy diet instead of not
Healthy diet rather than a crash diet. Yes.
Another question is, doctor, my daughter go to school and she's 13 years old and she is having gray hair. She's just 13 years old. Why she's having gray hair? Can it be reversed?
Okay, 13 years old, definitely that's what we call as premature graying of hair. Okay, so it is of concern, but sometimes that just runs in the family. Okay, if you have family members who sort of get gray very early, it might be normal, but it can also be because she might be undernourished or she might be having some deficiencies which might be leading to the problem. Medications, they are available, certain serums and some supplementations, these are available. How effective they are, it only depends when you can, see the patient, and then, for a long time they will have to be on the medication. Okay, so it's not something that's just going to be reversed at the snap of the finger. We first need to find out the cause, then address it properly, and still the chances are 50-50. Okay, sometimes it reverses back with proper treatment. Sometimes despite the treatment, if it's more hereditary thing, it might not get corrected. Okay, so again, consult a dermatologist in person, and they will sort of do whatever the tests that are required for her, and see why she's getting gray hair at such young age. Okay.
Okay, so once the root cause is identified, we can stop
Yes.
the
Yes.
Okay.
Yes.
Another question is, doctor, in thyroid patient, PRP will help in hair loss management?
Yeah, PRP can help, but it should be that your thyroid should be under control. Like, you are a thyroid patient, you're regularly on medication, and your previous thyroid profile should usually be normal before we can decide that you're okay for the procedure. If your thyroid is not under control, you're not on regular medication, and directly go for a PRP, it is not going to help. Okay. So, like I told you, the procedural treatments are only in conjunction with the medical treatment. Standalone, they are not that useful. And if you have internal issues that are constantly at play, which are not getting resolved, then I don't understand how external things can be much of a benefit to you. So if you want to get like the full benefit of the procedure, it has to go hand in hand. Your thyroid problem should be under control, and if it already is, yes, PRP will help you. Majority of the time it does help. Yeah.
Okay, the same person is asking, can you please explain PRP, doctor? Is it safe to take?
Okay, so PRP, as I was telling about the procedures previously, so what we do is, here we take patient's own blood. From that, we separate hair growth factors. Okay, your plasma sort of has certain growth factors which will help the hair follicle to grow out. Okay, so we separate this and we inject it back with very micro kind of needles back into your scalp. Right, so this sort of triggers the hair growth. So what was like has gone into a sleep mode is activated and has again started to grow. So to put it simply, that is how PRP and GFC, these treatments work. Okay, we are basically trying to put the growth factors back into the scalp and assist the hair growth.
Okay, so these are safe treatments.
These are safe. With is your own blood, na? We are not injecting something exogenous. Usually there are no allergies or anything. So it is pretty much safe. It's your blood from which just a plasma has been separated and it's being put it back into your scalp. But the thing you have to remember is, get it done by a dermatologist. Okay, you cannot go get it done by a quack and not expect to have complications. Okay, because strict asepsis is not something you can rely upon when you're getting it done by some other quacks or somebody who is nowadays become very common in salons and all. They keep doing all kinds of cosmeceutical procedures, so which is not actually something that government approves, but it still goes on. So I would suggest if you are concerned about it, get it done with a dermatologist who is a certified dermatologist, and with them the chances of complications are very, very, very minute. Okay, because it's a very safe procedure. Yeah.
Okay, now this is interesting question. Doctor, you said heat treatment should not be done, but I did heat treatment called keratin, because the surgeon person said me it will smooth my hair. After I did it, it was very good for 3 months, but now I'm having a severe hair fall. Can I reverse the problem?
So see, what damage has been done is done. Okay, so your hair will need some time to recover. Okay, it has to grow back again, because what hair is there, you've already sort of loosened the sulfur bonds within. So now the hair has become prone to breakage. So it breaks easily. For the hair to completely grow out, it's going to take time. You're going to lose the effect of the smoothness that you got, the straight kind of look that you got. But it will recover eventually. But my advice is, do not do future procedures like that again, because if you keep doing them, it's just going to aggravate the problem further. Okay, so if it was the hair loss is purely due to your keratin treatments, then I would suggest that you not go for the procedures and just take good care of your hair. But yeah, also it's important to sort of know if there are other issues that are contributing to the hair fall, not just this keratin treatment. So go get it checked once properly, and next time avoid these smoothing, hair straightening kind of treatments. What's done is done. Now take care of your hair properly, but usually it should recover. It's not like make a permanent damage. Hair usually grows out again, right? So at that time, if you are addressing it properly, you should be okay. Yeah.
Another question is, this is a little different question from our viewer. My daughter is losing hair from her eyebrows and also from her head. So is it she also have very less hair in her body, and she's just 10 years old. So do she has some genetic problem? But my mother never had such problem. Even I don't have it. So why my daughter has
Okay.
it?
Because the kind of thing that she is saying, the symptoms, it looks a little bit like alopecia, autoimmune kind of alopecia that we usually see. So I would suggest as soon as possible go and consult a dermatologist, because she is very young, and if she is using body hair also on the eye hair also, there's possibility that it could be autoimmune alopecia that needs to be addressed immediately. More hair keeps shedding off. So I don't want to alarm them. It might be other things, but there's a possibility that it's autoimmune kind of alopecia, and then they should go visit a dermatologist in person and get it treated promptly. Otherwise, there's chance that it keeps progressing. Sometimes it can settle back by itself, but sometimes it doesn't. Okay, so it's better if you have a dermatologist watching you through this in person. Okay, so go consult immediately. Yeah.
Okay. Another question from a viewer is, Doctor, I got diagnosed with COVID in 2020, and after recovery, I'm facing severe hair loss. So is it because of COVID, or is it because some deficiency I have? Should I need to visit the doctor?
Yeah, I think so. Post-COVID hair loss was a major concern for many of the people. Some people had after the first wave, second wave, whenever you got infected, people started just losing hair, and that does happen. It's not just COVID. You go through some major illness or any kind of viral or other kind of major illness, your hair, like I told you, body will consider hair as the last thing that needs, so it goes into kind of shock. Hair goes into shock and it sheds off. Okay, so maybe because post COVID she had it like a severe episode of COVID, and after the viral infection, the hair sort of went into a little shock and it sort of started falling off. But the thing is, 2020 was long back. It should have recovered by now if it was purely due to COVID, right? So, but maybe there's other issues at play here if it's still continuing after almost 3 years now. So I think it is time for you to visit a dermatologist before it thins out your hair further, and then see what is wrong with you in person. I think you should go there, visit them. Yeah.
Another very interesting question from our viewers. Doctor, where did you get hair like you? I think he's asking how your hair are very good.
How my hair is good genetics. It's good genetics, and of course proper hair care also. So I sort of, obviously I'm a dermatologist, so I have first-hand knowledge of what is normal, what is abnormal, what needs to be done. So you can come visit me. I can share you secrets. Okay, so we will see. Okay, so hair usually needs a little bit of maintenance from your side. Regularly I sort of do shampooing, conditioning, lots of things that go into it, and then if there's hair fall, we kind of address it promptly rather than delaying it, and then regularly keep a check on all of our nutritional things. So that is how we end up with good hair. Yeah.
The same. Is there any secret formula? The same viewer is
No, if there was, I would have been very rich. So I don't think there's a secret formula. I think it's consistency. Just taking care of your skin and hair should be like not something you do once in a while, but something you do on a daily basis. And I think that eventually that will show up. Yeah.
Okay, now because we are running out of time,
right? We're running.
Asking, Doctor, can you please tell me where is your clinic in Hyderabad?
So am I allowed to share that?
Yeah.
So my clinic is Dermvisa Skin Clinic. It's in Manikonda. It's in Hyderabad only. I think it's already shared in my portfolio where it is, the proper location also. It's in Manikonda near Marisettu Junction, Lanco Hills Road. Yeah, in Hyderabad.
Thank you so much.
Dermvisa Skin Clinic. Yeah. Okay.
Thank you, Doctor. Would you like to give us some take-home messages or any other suggestion to our viewers today?
Okay, so basically, at the end of this, I want you to remember, one is eat healthy, do physical exercise, take care of your hair and your skin, and do not delay the issues till it worsens and you then come at a stage where we can't really help you. So address them promptly. Dermatologist visit hardly costs you anything, but you'll have them to hold your hand through your process of hair loss and then help you with it in whatever way is possible. So it was great, talking to all of you and answering all of your questions. Thank you for your enthusiastic response. This was such fun. Yeah.
Thank you so much, Doctor, for sharing so much of information and all your expertise with us today and answering all the questions of our viewers. I'm sure our viewers have found this session very helpful.
Yeah.
Thank you, Doctor. It was a delight to have you, and thank you so much for your valuable time.
Thank you, Mona, for hosting me. You were such a great host.
Thank you so much. Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma signing off for today. Thank you.